started on the Q&A. This question is directed towards Dr. Lehrman. What are some of the trends you are seeing in the number and severity of depression and anxiety cases during the pandemic?
Thank you, Amy, and thanks, Suzanne, Steve, Mike, and everybody who put this together. And thanks, Carmen, for joining me today as a speaker. And also thanks to everybody in the audience for being interested in mental health, because I really believe there's no health without mental health. And so regards to the question, Amy, I think your audience is very aware of many of the stressors that this COVID pandemic has brought to our community. And with these stressors, we are seeing a lot of people struggling with a depressed mood and or with anxiety symptoms. Now depressed mood is a normal reaction to grief, for example. If somebody is grieving a loss, and there's a lot of losses, we'll talk about that this morning, associated with COVID-19 and our community's reaction to COVID-19, including the social isolation and how we've had to shut down everything in an unprecedented way. And those stressors lead to people feeling sad. That's not the same thing as the mental illness, major depression, and I will try to differentiate that a little bit today. And being threatened with a life-threatening illness like COVID-19 certainly makes us all feel anxious, and we're anxious about getting it ourselves or our family getting it. We're also anxious about possibly spreading it and exposing our loved ones and friends to it as well. And so it brings a lot of anxiety, and that's normal to feel anxious when your life is being threatened. So some of the anxiety and depression, the feelings of depression and anxiety are very normal. But at the same time, some of us are experiencing this, and it's taking us towards developing a mental illness, and then that when it gets that extreme, we need added help. And there's ways that even for us dealing with the stress can get support that can help prevent it from becoming to the extent that it's a full illness in itself. And so I think some of the things I'll talk about today are how to cope with the stress and fears about this horrible illness. So the numbers of people experiencing depression and anxiety disorders have gone up because of these severe stressors we're facing. And we're seeing some high levels of severity. And I'll also touch today on how that's affecting suicide rates across our community and addiction, utilization of substances, and to try to adapt, but it becomes problematic many times. I'll stop there.
Thank you, Dr. Lehrman. What are you seeing? Are you seeing a difference in people who were already suffering from depression, anxiety prior to the pandemic versus people maybe are experiencing it for the first time?
Yes, thanks, Amy. So when people have a history of having major depression or different kinds of anxiety disorders like post-traumatic stress disorder or obsessive compulsive disorder or panic disorder or generalized anxiety disorder, some of the common anxiety disorders, and they already have those disorders, they are at higher risk for having exacerbations of those disorders when facing stressful situations and or losses. And so people who already have those illnesses are much more prone to developing exacerbations and to have episodes of worsening of those illnesses during times of trouble like this that we're all facing right now.
How is the depressed or anxious family member affecting the household?
So everybody gets affected, especially more so now when we're all being kind of closed in together. So when one family member is struggling with depression or anxiety, it very much affects others. And so just to briefly touch on some of the stressors that this pandemic have brought to us, first of all, we've all experienced a lack of control in this. There's things that are beyond our control around this pandemic, and so people universally have sought to find control. One of the things we saw first in this is running out to get toilet paper. It's almost a little humorous if you step back and think about it, but what people were doing was trying to get control, to be prepared when we're facing this thing that was so out of control. And so that's one of the basic things, taking care of the basics. And so there's a loss of control, and that's a major stressor for us. The stress of the threatening illness and spreading it, the stress of change. We've all faced a lot of change in dealing with this. The losses, the loss of job, if you're furloughed, or some people, their business had to shut down, and even the loss of every day going to work is a loss for us and a change. Some of us are losing loved ones because of their deaths from this illness. We're losing celebrations. We're losing the plans for retirement and life savings and vacation plans and all kinds of things. And so with those losses, we're also experiencing a lot of grief. And so that is all being shared in that household, and especially since you're brought closer together within the household, we all have to come together to support each other more now than ever before as a family. But that also can lead to conflict and stress in our relationships between each other. This has brought a lot of, there's opportunity for coming together and developing, quality time together and closeness. But there's the other side of it, is that it's stressing relationships in families more than ever. And when you add the complexity of somebody struggling with depression that might be facing feeling helpless, hopeless, needing a lot of reassurance, or somebody with anxiety needing a lot of reassurance, that stresses the whole system even more, the family system.
And then, John, how might an employer see this depression, anxiety, or substance abuse manifest in the workplace?
So, great question. And I think it's harder now for employees to see it than when we were all in the workplace together. Since many of us were sent home to work, it's harder to appreciate. And I think we even have to give more effort to stay connected with our employees if they had to go home to work from home, as many of us have had to do. And so how will it present? It presents with, oftentimes an employer will start to see a decreased performance. Now that's hard to separate out if you're not staying really connected with your employee. Could it be because they didn't have the technology adequately set up at home for them to do their work as productively as possible? Could it be because, for example, in healthcare, patients are coming forward for care as much as they were before? There's lots of reasons. Or could it be that they're struggling with depression and or anxiety or substance abuse, and that in itself is affecting their performance? So the first thing I think is employers need to stay connected with their employees. And I think that's a really critical part here, and so that they can fully understand what's going on. And it's challenging. It's really challenging for our employers to do that.
And then, John, Dr. Lehrman, how might stressors differ between those who have remained in the workforce, those essential employees, versus those working from home or those temporary furloughed?
It varies greatly. Everybody has stress. So we're seeing in healthcare, we're seeing people on the front lines experiencing a lot of stress in delivering healthcare. And I know there's other people on the front lines delivering food or working in supermarkets and these essential employees that are doing really critical work that are facing high exposure risk to COVID-19. That is very stressful. And then they're afraid they're going to bring it home to their family members. And that's a serious concern. Some of them are not even going home to their family members, and they're staying elsewhere so that they don't bring it home to their family members. And that creates stressors. And so then those who are working from home, there's all kinds of new stressors there. So if you have children and your children are doing school from home, there's a lot of distractions at home now, and that's stressful to try to be productive at work. And maybe you even have to do the homeschooling and spend more time teaching your kids and the taking care of your kids. So how do you balance that while working full time from home? It's impossible. Yet they're put in this impossible situation. There's the stress of even initially trying to make the technology work out, as I experienced just a few minutes ago, trying to connect to this meeting. It was very challenging. My computer wouldn't connect to the links that were needed here. So there's a lot of stress from working at home. Then to think about those who have been furloughed. So one of the things I'm doing right now at MCW is I do a virtual support group for furloughed individuals that have been furloughed at MCW and across our health system. And so I'm hearing firsthand the stressors that they're experiencing and trying to provide support to them. I mean, think about it, for you to be sent home and first of all, you get angry and frustrated and, why me? And you feel betrayed perhaps by the organization that furloughed you, that you've dedicated many years of your career to. And then there's uncertainty. Will I be able to come back? And how do I stay connected, or can I? Because you can't work when you're furloughed. And so there's a lot of tension there and a lot of fear there. And then think about the challenges of trying to get unemployment. I have still some individuals that have been furloughed that still haven't gotten their unemployment benefits, and they've been waiting for several weeks, 4 or 5 weeks already, and they still don't have those benefits, and they're starting to worry about how they're going to support their rent and support their families. So there's a lot of stressors in each of those groups, and they differ, but there's a lot of stress.
Thanks, Dr. Lehrman. What do you anticipate with employees that will be returning to work that have been working from home?
So there's going to be challenges there too, in that there's going to be fears. They probably felt a little bit more secure about risking being infected with the COVID-19 and by being at home and feeling protected. Now going back to their workplace. There's going to be, anxieties about changing back and about risk of getting COVID-19 or about staying safe. But there's also, again, there's going to be challenges. They'll likely be excited to go back to work in many ways, but there'll be challenges going back to work too and kind of getting everything back online, because we're going to be in a changed world. Certainly in medicine, for example, in behavioral medicine, psychiatry, we're not going to all be coming back in the same way. We're going to be delivering telepsychiatry from our home to our patient's home much more in the future than we ever were in the past. We were inhibited from doing that in the past because we weren't able to bill for that kind of care. But now that it's been allowed, and I think it's a very patient-centered way to deliver care, and will oftentimes be preferred, I think we'll be doing that much more. So there's going to be changes in lots of ways that we do business. There's a silver lining. We're going to adapt some of the practices we've implemented that may be best practices during our changes that we implemented to stay working. Some will move back to the old way of doing business, but we have to figure that out and and figure out the best practices. But I think our business is going to change greatly in almost all businesses. I think our business will be very different for years to come.
And then, Dr. Lerman, what do you think are some communication strategies for talking to an employee, who an employer suspects is living with depression or anxiety?
So I think that's a really important question, and again, of course, it's challenging. I think we need to check in with our people, and I think we need to do that more now than ever, especially if they're working from home. And so one thing that for example, my team is doing is they're having a morning check-in where everybody connects, with their work team, and every day, and then by email every morning they all say, good morning, and they all connect and make sure that everybody's together, everybody's doing their thing. And I think that's really important. We've started a weekly town hall meeting in my department that I lead to give everybody updates on what's going on across our business. And we also announce successes. During this really hard time, you really need to celebrate your successes. But I think so I think checking in is really important. And of course, it's the individual's ultimate responsibility to take care of themselves and get help. So as an employer, if you become aware that one of your people is struggling, encourage them to go to EAP, encourage them to get help. Just because our clinic, for example, at the Medical College of Wisconsin, our psychiatry and mental health clinic is not seeing people in person, doesn't mean we're closed. We're doing telemedicine. In fact, we're seeing the same volume that we were seeing in person. We pivoted and are doing it all through virtual telepsychiatry, telemental health visits. And so we're providing lots of mental health care. We've never been sidelined by this. We've just had to pivot. And so there's mental health care available if somebody needs it. And, I think some of the things that we've got to look for, I talked a little bit about everybody's going to feel depressed, everybody's going to feel anxious. It's when the amount of depressive symptoms, and I'll discuss them right now. So a depressed mood, decreased energy, decreased motivation, feeling hopeless, helpless, worthless, trouble sleeping, trouble with appetite, having suicidal thoughts or thoughts about wishing you were dead or that you'd be better off dead, problems with concentration and short-term memory, not enjoying things in life like you used to. If you have 5 or more of those symptoms ongoing day after day for 2 weeks or more, that meets the criteria for major depression, and you need to be getting some help and some treatment. And that treatment, major depression, is very treatable. We treat it with a combination of medication and psychotherapy, talk therapy, and you can get access to that through your primary care provider. They can refer you, and or through a mental health clinic. And so we need to get help when we need it. From an anxiety perspective, it's how anxious. If you have panic attacks, for example, that are disabling, and you're so fearful of the next one that it's disabling you and preventing you from doing your day-to-day activities and your work, then you need help. If you're so anxious, we're all more anxious right now, but if you're so anxious that you can't get things done day after day after day, you need help. From a post-traumatic stress disorder, there is trauma here. This is life-threatening. We're facing something that's life-threatening. We are at risk for developing a post-traumatic stress disorder, and the symptoms of that include hyperarousal symptoms that include hypervigilance, anxiety, irritability, problems sleeping, falling asleep, staying asleep, jumping at things when you have an increased startle response. Then there's the avoidance symptoms, where people avoid things that remind them of what was so stressful. So certainly people working at the front line in healthcare are at risk for developing PTSD right now. But others might be too. If you had COVID, you're at risk for getting, even if you didn't end up getting so sick from it. But if you had it, that's a life-threatening illness, and that scared the daylights out of you, I'm sure. You could be at risk for having post-traumatic stress disorder. In addition to the hyperarousal and avoidance symptoms, there's also reliving symptoms where people have nightmares about it and flashbacks and or recurrent intrusive thoughts about it. And if somebody has those symptoms and they're disabling and ongoing for greater than a month, then they may have PTSD and they need to get treatment for that. So those are some of the things that we need to look for. From an addiction perspective, we're seeing alcohol use go up tremendously. People tend to use alcohol and some drugs to escape. They use it to cope. In a maladaptive way, it can be, they use it to cope. The problem is when they start getting hooked on it psychologically and physically, and it starts causing problems for them in relationships, in their ability to do their job, in getting drunk driving charges. And they continue to use, that's a serious problem. Those are signs that it's a serious problem. One of the things that you can't tell now, since if people are working from home, is if they have alcohol in the breath. But if people are drinking during work, that's a problem. And it's hard to know if you're a supervisor, an employer. It's hard to be aware and know that from a distance. But if you stay connected and you're checking in with people, you might notice some things, that they're slurring their words or things like that. And again, monitoring their performance closely, you might pick up on that. But you won't know for sure what it is probably. In the workplace, we usually can sense it better because you can smell the alcohol. The opiate epidemic hasn't gone away. Every year in our state, about 800 people die from opiate overdoses. Just so everybody realizes, that's more than those that have died from COVID-19 so far in Wisconsin. So that problem hasn't gone away, even though there's no attention, hardly any attention towards it right now with COVID going on. But people are using opiates to escape and other drugs to escape. And so that problem is getting worse too. And we're likely to see a surge. I talked about depression and suicide. Right now in the country of Australia, they've had more suicide deaths than COVID deaths since the beginning of COVID. And I think we're going to see a very significant surge in mental health problems as we recover from COVID, as almost like a second wave. And we are going to see a surge in suicide in our country. Already it's up 30% since the late 90s, but we're going to see a surge. Whenever we see an economic downturn, we see increased suicide rates. And the best way for us to best address that is to continue to support each other and get people help when we notice they need help. I'll stop there.
Carmen, are you seeing depression and anxiety impacting the domestic violence?
Absolutely. It's one of the top two concerns that our survivors report. I agree with Dr. Lerman. It's nice to be with you, Dr. Lerman, and thank you for the opportunity. My fear is the second tidal wave of this pandemic will be in the area of basic needs and mental health. As Dr. Lerman said a couple of weeks ago, I got a stat. We have an 80% increase in suicides in Milwaukee County since COVID. And I think that my fear is that will continue to increase. Our survivors do report mental health crisis and isolation of being a top concern.
And besides the depression, anxiety, and Dr. Lerman kind of talked about the substance abuse, are you seeing then that direct correlation as well to the domestic violent trends in the Milwaukee area?
Well, what I think is important, I want to make a couple of overarching comments. I've been looking at a report called Death by Despair, was published by Task Force for America's Health a number of years ago, about 4 years ago. And we're tracking a different type of death at the federal level, which is any suicide or overdose death. And they were predicting up to 3 million within a 10-year period. I think since COVID, that's going to significantly go up. It's important to understand that violence is a learned pattern of behavior that thrives in isolation. It can include physical, emotional, sexual, or mental abuse, and it can be subtle to severe. And what concerns us the most about COVID is that it has further isolated survivors and sort of demanded that they stay at home, most likely with the person who's been hurting them. So from the very beginning, we've been concerned. We were grateful to the governor for putting domestic violence agencies as essential workers. So we have continued to operate throughout COVID, and many of the shelters and organizations working in this field have across the state because we want people to know that they can leave and they can seek safety. So we were grateful that that was actually in the Safer at Home order. We initially saw an increase to our hotline calls at the beginning of COVID. We saw an increase from police reports to our hotline, but that overall general calls to the hotline have gone down, which concerns us and means that people are not reaching out in the same ways that they were before. Our hotline in general is down about 50%. We have seen an escalation in domestic violence homicide. Pre-COVID, we had a state of emergency. Before COVID, we had 13 domestic violence related homicides this year since January. As of today, we're now at 25 domestic violence related homicides compared to 5 during the same time period in 2019. So very concerned about the homicide. According to some reports, it's gone up by 98% here in Milwaukee County. A domestic violence related homicide includes intimate partner violence, but also family member, like mother, son, the cousins, cousin to cousin, brother, sister. We're very concerned about the violence that's happening in our homes in Milwaukee. Our referrals are down. We had to cap our shelter at 43. We normally have 53 people who can stay with us, but in order to accommodate social distancing, we had to cap the shelter at 43, and we're generally about 90% at capacity. We had to move our restraining order system online, which is also very difficult. It's made the process much more time consuming. It takes about an hour and a half to 2 hours to file. The court operates remotely now, and you still have to go in for your injunction hearing. We have seen an increase in mental health requests and appointments through our partners here. And my other big concern is, the antidote for us to violence is human connection. And what COVID has done is it has cut off our connections to each other. We're no longer able to gather in the same way, go to work, go to church, celebrate, as Dr. Lerman said. And that really is critically important when you're looking at trying to heal violence in people's lives. And so I'm afraid about the future and how we're going to continue to help people heal themselves when they've been impacted by violence. It's also important for offenders to have that human contact with others when they're trying to change their behavior. So that's sort of some overarching things that we've seen. We put out a safety bulletin right during COVID on our website, familypeacecenter.org, which is about trying to keep yourself safe in the midst of living in violence, which is a different type of safety planning if you cannot get out of the home. We put that out, and we've been doing lots and lots of media about us still being operating because we want people to know that they have options.
Thank you, Carmen.
Mm-hmm.
With some of those trends, are you seeing the police and you seeing some of the first-time cases of domestic violence or child abuse?
Yes, we are. Child abuse has gone down significantly, which is also of great concern. Kids are no longer in public spaces the way they were before. So we've gone almost down to 0 in our child abuse reporting. They're no longer at school or around other adults who can make a report. And so I'm concerned about what's happening to our children who are stuck in place. We are seeing, and police have reported, and the DA's office has reported, a number of first-time domestic violence arrests. But it's important to remember that usually by the time law enforcement is called, there's been multiple incidents of violence that have never been reported. Most people don't joyfully pick up the phone and call law enforcement and say, you know, I need some help. It's usually an entrenched pattern that has been happening repeatedly in people's lives that compels them to pick up the phone and call law enforcement, or they're so fearful for their lives that they'll make the call without really thinking about the system that's going to get engaged. So we have seen first-time arrests happening, but we need to remember the underlying conditions of what may have been happening for that family for a while before the report has been made.
And then with some of these trends, is this unique to Milwaukee, or are you seeing this trending nationally or even globally?
It is trending nationally and globally. The World Health Organization just put out a report 2 weeks ago that said they anticipate, at the time they anticipated if the lockdown continued for 6 months, there would be 31 million new domestic violence reports across the globe. And we're certainly seeing that happen here in Milwaukee. You know, I don't think, and I'm very careful to say, I don't believe COVID is causing violence. I think it's creating stress in people's lives. And if you grew up learning that violence was a strategy that works, you saw people using it in your life, you learned that it was a behavior that's acceptable and normal, and you're using it in your life, you're going to use it when you're under stress. You're going to turn to the behaviors that you learned in your life. And so I don't think COVID has caused it. It needs to be there organically as a learned behavior. It certainly has made everything worse, and I think it will continue to do so across Milwaukee, the state, and the world.
Carmen, how might an abuser's behavior play out differently during a safer at home versus where they, you know, were able to get away from their spouse for a while? Are you seeing a difference in behavior as far as like withholding essentials or?
Well, you know, abusers have always used control and jealousy and isolation as tactics in relationships. What we have heard survivors reporting, what we're afraid of is that abusers won't allow survivors to have accurate information. They may blame them if they get infected or accuse them of being infected. They will control, as I said, information. They'll control the environment. So we're afraid that they will continue to use the isolation in a way to trap the victim even further under COVID.
What are some of the types of behavior to look for in a person that is being abused if there's no physical signs that they can visually see? So from an employer, like when they are doing these check-ins, you know, what are some of the behaviors that you could recommend them looking for?
I think it's important to look for, when you're with people, unexplained absences, you know, and stories that don't match. If you can see, for instance, this is a blatant example, but I have a handprint on my hand and I said I ran into a cabinet. So unexplained injuries with the explanation that doesn't quite match, frequent injuries, obsessive absenteeism, abusers showing up at work, aggressive behavior by abusers, controlling behavior, all of that now, since we're no longer working in the same way, isn't observable by our HR departments or our security departments, right? So I think you will have to, what I think is important is for companies to create an environment where it's safe to come forward. And how you do that, I think, is give the message that you take the issue seriously, you understand it, you provide training, you have a commitment to prevention, and that, you know, in your company, you want people to know that you care about them, you will believe them if they come forward, and you're there to be a resource for them. So I think training, messages about the commitment to the issue and addressing it if it happens, having policies and procedures that are clear, that define the role for security, HR, are really critical signs that can say to an employee, if they're struggling, it's safe to come forward.
And I think that's really good information, Carmen. And I think that actually kind of leads to a great follow-up question that came in as well. And this would probably go towards Dr. Learman to kind of add into that same piece is, how can we support our employees or coworkers that are struggling with depression and maybe are calling in sick because of it, or anything else any other tips and tricks that you might have?
Well, I'll let for us, I think our survivors want to be heard. They want to know that you will believe what they're saying. And so for us, the most important thing is to make space for people to approach you and to tell you what's happening. And then for you to say, I'm a resource for you. Dr. Lerman, I'll let you give your medical advice.
I don't know if you might still be muted, Dr. Learman.
Okay, sorry about that. Thank you. Thanks, Carmen. I think first and foremost, I think our employers need to be empathic, be able to put themselves in the shoes of their employees and understand where they're coming from. And so to be supportive, be caring, be understanding, try to be patient. I think during these times, this is not a time to make, if at all possible, this is not a time to make downsizing decisions and to push and stress your employees, to whip them into shape and make them be more productive than ever before. This is a time to be understanding and supportive and caring. I also understand you're trying to run a business, so you do have to have productivity. But I think be understanding and be patient and try to understand where your employees are coming from. I think that's probably the best way, because depression will affect, as I mentioned with the symptoms, it will affect their performance and their ability to function. And so if they truly have a depressive illness. So making sure that they're readily available about resources, that they're not stigmatized for getting help in your organization, that they understand that their boss understands that people do struggle with mental illness just like they struggle with diabetes and hypertension, and that let them have the time to have an appointment with a mental health professional. And the more that you can be supportive, I think the better.
Yeah, I would add to that, I always say there's a couple of messages survivors need to hear. It's not your fault. No one deserves to be abused or hurt, and I'm here to help. Those are always the three messages that I try to work towards. And I think those are important messages for all of us to be saying to survivors. I think as an employer, you should be looking for a confidential way and a respectful way to mention to the person if you're concerned. Let them know you understand the issue, that you're available to listen if they need to talk, and that you're concerned. I think it's also important for us to understand that people are autonomous, self-determining human beings. They have the right to make decisions, and unless it's impacting the workforce or performance or productivity, we should really give people the right and the privacy to make decisions that they feel work best for them. It's complex. Leaving can be very complex and very difficult. And I think you can be proactive as employers in a couple of ways. You can educate yourself about the system that exists, get to know a couple of providers. What are the options, for instance, if you're trying to leave a relationship, so that when you're having the conversation, you have a sense of knowledge about what you might be recommending and how to support somebody in that process. I think clients have said to us they're very afraid about losing their job, and they're very afraid of confidentiality. So I think policies and procedures really need to guarantee respect and confidentiality, and shared information on a need-to-know basis. I think you can be proactive rather than waiting for someone to come forward. I think there are a lot of survivors who are looking for signs that it's safe to come forward. And so I think those are important ways that you can address the issue.
Great additions, Carmen. Thank you.
Yeah.
I just wanted to also add, For family members, one of the questions earlier is how stressful it is if you have a family member struggling with mental illness. I just wanted to also remind employers that they should encourage their employees, if an employee is struggling with a family member that has a mental illness and it's really, they can tell it's stressing their employee out, encourage them to connect with NAMI, again, that National Alliance on Mental Illness, that it's an organization that supports family members and helps educate people about the impact of mental illness.
I will also say a lot of clients are told that they're mentally ill by abusers, so there's a lot of fear and stigma when people come forward when they've lived in violence. And so I've said to survivors, of course you would be struggling if you cannot live in terror and not have impact of that. So I think it's important for us to normalize and affirm for people the difficulties that come with and the ways that you have to self-repair from living in violence. I think overall we have a lot of work to do in our society to make it safe and okay for people to come forward. And maybe that'll be one of the gifts of COVID, is we're all struggling. Life is so fundamentally different and we're breaking in so many ways. I hope what comes out of this is the permission to seek help when we're struggling. And along with that would come, people who are hurting and people who are hurting others.
And Carmen, earlier you had mentioned with the reporting of child abuse going down to almost zero. One of the questions that had come in is, what are some of the things that we can do to help detect signs of domestic violence that you can't see? So if we're not physically with those folks, what are some of the signs that we might be able to get to help to see that they may need, or may be suffering, or may need some assistance?
Well, I was thinking about that. You can pay attention on Zoom calls. You can listen to what's happening in the environment, pay attention on phone calls. Pay attention to what survivors are saying. They may be giving you clues without actually coming out and saying, this is happening to me. Survivors have said they sort of test the water, right? They want to know that you're not one more person that's going to judge them for the behavior or add to their burden. So they may test you by putting something out to see what you say. And that's why I always recommend think about how you would intervene proactively, so that if you're confronted with the situation, you can do it in a way that opens a door instead of closes one. So pay attention when you're on Zoom or phone calls, pay attention to what your workers are saying. And those would be the first three. If you're a friend or a family member or a coworker, I would say check in with each other. That's the other option that we still have left under COVID, is if you have a suspicion that someone's struggling, give them a call, let them know you still know that they're there. They may be socially isolated, but you know that they're present and they matter to you. I think that's critical.
Awesome, thank you.
And then Carmen, how important is it for an employer to have a security assessment tool and plan to protect the abused and in the workplace?
Well, I wanted to say thank you to Mike. Mike and I have gone back probably, I don't know, maybe 30 years or so, and have done work together. I think the important thing about work is it's the most predictable place that I can find you if I want to hurt you. That's not true under COVID, but it was the most predictable place that I could hurt you and find you. So I think we need to be thinking about security in our workforces. Almost all of the mass shootings that have happened across the country have had some element of domestic violence in them. And so it's important for us to understand that. There's a couple of different tools and resources that we use here at Sojourner. One is the lethality assessment protocol. All of the law enforcement jurisdictions in Milwaukee County use this protocol. It's an 11-question survey that officers ask at the scene, and it will give you a score, and it'll tell you how likely that person is to be a victim of homicide. And then they report that score. Some of the challenges with the tool is it emphasizes risk, so it has to be recalculated. People fall anywhere from 24 to 26 are at high risk, are facing the potential of homicide. And so we change our advocacy and our conversation with those advocates. I would recommend that companies think about the lethality assessment protocol and having your security teams trained And you can call us. We have a member of our staff that's on the advisory committee in Maryland that came up with this tool. I'm not sure that it is developed to be implemented at the company level, but I think I would certainly want to explore it with companies. It can give you good information, again, not to, I think it's important, it just gives you more context about what's happening in the relationship and the danger that the survivor is facing. Survivors have said when they hear an advocate, a police officer, and a district attorney say, you're more likely to be murdered, looking at what's happening, they listen a little differently. There's something called the danger assessment, which is another validated tool that was developed in the healthcare arena by Jackie Campbell. That is another tool that you could consider getting some training on. And then there's Mosaic, developed by Gavin DeBecker. And we also use Mosaic, but it's a very lengthy process. It can take 2.5 to 3 hours to finish with the survivor. So I would say you should be thinking about assessment protocols, but you would need some training and some context for how you implement them in your company. And then my fear is I wouldn't want a company to use it to force a survivor to take one course of action versus another. Right?
Sure, that makes sense.
Mm-hmm.
Steve, do we have any questions at all from the panelists?
Yeah, so one that came in as a good kind of a segue out of that, Carmen, is, as we're looking at, the opportunity to bring people back into the workplace, maybe on temporary or rotating basis, is there any sort of strategies or things that we can look at that if we do suspect that there might be abuse issues or anything in the home, to try to get those folks back into the workplace or afford them the opportunity to get back into the workplace a little quicker?
I think that would be a great strategy if there's someone, because work represents a respite and potential for leaving for most survivors. They say, I couldn't leave because I didn't have my own job, I didn't have money, and I couldn't see a future for myself. So if you have a suspicion that one of your staff is being abused, you could offer them an early entrance back into the workplace if it's safe to do so. And if they chose to do that, you could also look for an opportunity to bring them in and have a conversation, a respectful conversation, right? It could go something like this. Hey, Steve, I just listened to this webinar and I learned this information about domestic violence. I found out it's so prevalent. And, I wanted you to know I've been concerned about some of the things that I've seen. And I wanted you to know if something's happening to you, I'm a safe person and I'd be willing to help. Is there something I can do? Or so some version of that. That was off the top of my head. But look for an opportunity to create rapport with the person and then give them an opportunity to make a disclosure and understand that they might not do that right away, but at least they know that you're willing to listen. Suzanne asked, how would you pick up the presence of abuse on Zoom? You would listen for yelling or behavior, a person who won't leave the room, those are just sort of quick answers to how you might be able to pick up on violence. Nervous or anxiousness on behalf of the survivor on Zoom might be some of the ways that you could pick up on it.
Very good, thank you.
The other thing about modality I would recommend, when I worked at City Hall for Mayor Norquist, we had a threat assessment team. We had our head of security, myself. I ran the domestic violence, Commission on Domestic Violence and Sexual Assault, and we had our EAP, the EAP, HR, and myself would get together anytime a restraining order was applied for and granted for a city employee or against a city employee. We would get together and talk about the response that we needed to have on behalf of the city. And then we also trained every city employee on the dynamics of abuse and the policy, our policy, workplace violence policy, and how to report.
And a question that came in, this is for both Dr. Lehrman and you, Carmen. Someone wanted to know, wondering how we can, as employers, support employees who have adolescents at home who are struggling as a result of the COVID-19 isolation. Dr. Lehrman, we'll hear from you first.
Sure. So I think adolescents are, are facing a lot of stressors unique for that age group. First of all, they're missing out on all the social reinforcement that they get that really helps them with their self-esteem from in-person connections at school, and having the schools closed and having to work from home and not being able to get together with their friends in the same way really challenges them. And I think they also are missing out on a lot of things. I mean, the sports that many adolescents love and are very active in, to have that all shut down and have that avenue for daily exercise taken away from them. And then you take away the structure that they have with school and with sports, and that affects them. So I think, I think helping coach the employees maybe a little bit. First of all, just being empathic again and voice understanding. But also there can be some coaching, I think, of them. I mean, one of the important things is to help their adolescents try to, stick with regular routine. Make sure that their adolescents are getting some exercise. Maybe allow for some quality time, maybe during the day, that maybe you give them permission, the employee permission to spend an hour or a half hour, in the morning, half hour in the afternoon, but you extend the workday a little bit, but they get time to spend time with their adolescents or their kids, and you can allow for that and be flexible around that. And maybe today, we can be more flexible because of the telework that we're able to do. Some of my people do more work at night, especially around education and developing lectures for medical students, for example. And so I'm more flexible and let my employees have more flexibility than around their schedule, so they can spend a little bit more time with their kids during the day, but then at night they're doing their work and getting it done. So I think that's something. But being understanding, being supportive, and listening, being a good listener, so that your employee has the ability to kind of share what's affecting them and how it's stressful for them.
I would say our kids need us to role model walking through our feelings instead of avoiding them. I think this is such a massive, massive event. It's a 100-year event, and it's unprecedented, and it has caused loss on every level that I can think of. And I think, we are swimming in a sea of grief and loss, and our children need us to role model that we have to walk through it. And part of that is feeling it, allowing it, making room for it, not avoiding it, not pushing it away. It really demands that we be present to it if we can. Now, many of us have lots of old hurts that we've never been able to heal, so it's compounding what's happening for us. But the beginning of healing for me and our clients have said is you have to begin to hold space for it and to acknowledge it. And I think more than anything, in appropriate ways, our kids need to hear us and see us navigating our own emotions. And then we may need to make time to be with them and to make space for their emotions and their feelings. And, we're facing uncertainty, and to be there with them in the midst of it, I think, is really critical. I think finding things and ways to praise your child for their strengths in the midst of all this uncertainty, keeping up routines is really important. Finding time to play with them, give them attention, even when they don't want it, are all critical things. We have a brochure that we've done called Children, Domestic Violence and Trauma, which you can find on our website. And it's some basic ways that parents can look for symptoms of trauma in their children and then respond to it. This is what it looks like if you'd like one. But I think we live in a culture that we're told that our feelings are somehow not okay. And we have to change that message.
I think that's really important, Carmen. Thank you. You mentioned the grief. I think COVID-19 is an illness that's bringing about tremendous loss for every one of us, and so we're all grieving, and we're grieving the losses that we faced and that we continue to face with this illness in so many ways. And some are perceived losses, some are real losses, and some are losses that are yet to come, but we anticipate them. And the normal stages of grief are we go through feelings of initially denial. You can't believe you lost that. You can't believe this happened to you. And then there's anger, and anger is part of it. So to feel angry about not being able to, about losing your graduation ceremony for an adolescent, losing your season, your varsity season of soccer that was lost to you. You know, it's okay to be angry, and as a parent to allow for them to express their feelings and voice an understanding. I think you as employers can also model some of this listening and empathy and allow your employees to express some of their feelings about their grief. Bargaining, oftentimes that's the next stage of grief where somebody who's lost someone or lost something is trying to make a deal with God or make a deal with to try to get that person back or to try to get the job back or to try to get a season back. And then depression. Depression is actually feeling not the 5 or more symptoms for more than 2 weeks, but some of those symptoms of depression that I described earlier, they do hit us when we're grieving. And finally, we get to a point of acceptance. And when there's so many losses that we're all dealing with, it's hard to get to that point of acceptance, but the only way we can get to it is by working through it. And most of the time we work through it with friends and family members. Most of the time we don't need a professional. But if we are getting stuck, then somebody does need to get a professional. And as an employer, you may recognize that sounds like somebody's kind of having trouble with their grief, and you might encourage them to, again, talk to EAP or to consider getting some help.
And I think, I'm sorry, Amy, there was a couple that came in on the private side for questions I think are a really good transition, because you talk about a lot of the feelings that people are experiencing, Dr. Lehrman and Carmen. And one of the things that, you know, people are starting to wonder is, as we are returning back into the workplace, it's obviously going to be very different, as you described earlier. So how are we going to help our teams, our coworkers and family and friends deal with anxiety, getting back into that society after they've kind of been locked in for 10 plus weeks? And obviously there's going to be new safety standards and different things that they're going to have to abide by. So that's going to cause more anxiety on top of it, because it's a loss of control. It's a change in the routine yet again. So what are some of your thoughts as far as the upcoming anxiety?
So I think we need to be patient with our people as they come back into the workforce. We need to kind of reorient them. We need to involve them in some of the decision making on, when possible, about how to make things safe. What are their concerns? Get their input. You can start doing that now. You know, if they're not back yet, but they're going to be coming back, you know, reach out and ask them what are their concerns about coming back, and hopefully you can address some of those even in advance before they come back. But yeah, I mean, we're setting up our waiting rooms so much differently in healthcare, so that people can socially distance and you know, so work isn't going to be the same, and so if somebody's sitting at a desk, but they interact with clients, are you going to put plexiglass, and can you reassure them that they're going to be safe? Do you have enough protective equipment, the PPE that's so important? So I think a lot of reassurances you can give as employers to help as people face coming back, but then allow them to have some input, and then not only to try to address it now, but then even check in with them, you know, the first day, and then again as the first week comes to an end. How are things going? Any concerns? Is everybody feeling safe? You know, I think that kind of thing, attentiveness to their concerns, goes a long way to their engagement, and that also helps reassure them that they have a voice as you go forward.
So I agree with Dr. Lerman. At Sojourner, I've assured staff, we've done the weekly twice weekly, now weekly town hall meetings. And I think sharing information is really critical and important. I've said to staff, we're going to do a slow start. We're not going to flip a light switch and then now we're back at work, just to give, you know, to help people transition back, that it would actually be a transition and that they would have input. We've been seeking their thoughts and their opinions and implement, you know, putting it into the plan. We also let them know that there'd be a written plan that they would see and get as we're starting to come back. We found that there were lots of questions about the sources of information that we were listening to, because there's lots of confusion, right? So we have said to them all along, we're listening to the city, the health department, the World Health Organization, and the CDC. And then we've generally said, here's the framework, you know, what are going to be the expectations around social distancing and mask wearing? How have we increased our hygiene practices? We're going to begin to take temperatures, meeting size guidelines, so that they have information so they can start integrating it as they're beginning to come back. So those are some of the ways that we've approached a restart.
So Carmen, I also think, I want to add that I think with the furloughed individuals and they're coming back, we need to take a little bit of a different approach. It can't be just one size fits all. First of all, I think especially if we're not connecting with them regularly while they're furloughed, and hopefully people are, but there is going to be some resentment and anger that they're going to have. And so I think meeting with them one-on-one, as a supervisor with your furloughed individuals as they return, acknowledging that this was unfortunate, acknowledging how hard it must be for them to have been furloughed, maybe acknowledging that they took one for the team by being furloughed. But then, first of all, giving them a little bit more of a notice, if possible, about when they will be coming back so they can start to plan for it. And then, is there a way to reorient them, to update them on what's happened to the business since they were sidelined? And then again, to be patient on getting them up to speed. But are there things that you can do to make them feel to be a part of the team again, versus to be kind of the one that was left out, and maybe they feel less important or less respected or less needed by the organization, which oftentimes isn't the case.
Very good points, very good points. And I think that, you know, there's a lot of times where people are expressing anger for one reason or another, and a lot of that is around getting back into the community and should people be wearing masks, and if they're not, why aren't they? And do you see that a lot of that frustration is just because of the uncertainty, or do you think that there's just a mix of some bad behavior that's out there?
So I think all the stress that people are dealing with makes their tempers shorter. Also, all the grief that people are facing. I mentioned anger is part of dealing with grief. So it gets built up, and sometimes people kind of bubble over, and it comes out. Again, having a culture in the workplace where people can honestly share feelings, and also a culture that doesn't allow anger to be expressed in inappropriate ways, that it gets called out if it's inappropriate. I think that's really important as people come back to work. But I think we need to be understanding, we need to be forgiving, but also certain kinds of abusive kinds of things can't be accepted, obviously. But I think there is a lot of anger and stress and frustration out there. And part of that comes from the fear, right? The fear that somebody else not wearing a mask is not respecting you and putting you at risk. And we want everybody to be thinking like we are, but we don't always know where that other person's coming from in the situation they're coming from. So we've got to be careful not to be judgmental.
And there's different levels of denial. You know, there's different ways that people have been able to integrate and not integrate COVID, especially with our clients. A lot of our clients, you know, don't have the same sources of information. Some of the organizations that we work with, their clients have said they don't believe that COVID is real. They believe it's a conspiracy. They believe there's all kinds of ways that we have filters that filter information that we're able to receive or not receive. So I think people are navigating this disease in a variety of different ways, and that can cause frustration for many people. And I think it's important to remember that denial and is very much a part of how people are trying to get through this.
Wonderful. Thank you very much.
Dr. Lehrman, with regards to kind of going back to, employers helping, their employees that have adolescents at home, you guys talked about some great things with routine, exercise, being a role model, praising for strengths. And then I was wondering what your thoughts are on, there's been a lot more in the news on meditation, and if you have any recommendations, maybe to get it as a family together, or trying to help with a teenager or someone a little bit younger, even helping with that meditation to help them cope.
Great question. I think there's been a great movement towards mindfulness and meditation, I think, over the last several years, not just recently with COVID. And I think being thoughtful and mindful is learning how to do that, and learning how to meditate actually can be a great way to cope. And so I know there's online teaching sessions. I don't have one specifically. There's books out there about mindfulness and meditation, but I think it's a way to help control those feelings and to address the feelings that might be driving some of the things, some of your actions. And so the more in touch we are with our feelings, the better off we all are. And so I actually think mindfulness is a great, it's a great approach for all of us in addressing our feelings and better being able to cope with every day and the stresses of every day. And so it's even more important during a time like this when there are so many stresses. And I think, a lot of it is just paying attention to what's going on inside of your mind and your body, and things like just controlling your breath rate, your breathing, your relaxation, your muscle tension, and there's things that you can learn to do through relaxation techniques, through different ways to focus, take your mind to different places that can really be strategic ways to cope, and there's ways to remind ourselves of those kinds of things. So there's courses for that, there's online teachings and readings for that, and there's certainly books. So I think that's a really valuable way. And again, by leading by example, a parent can do that and then help their children learn how to do it as well.
I think there's also apps that you can download. There's a Waking Up app by Sam Harris that teaches the basics of meditation. There's lots of ways I think that you could get your adolescents and your children into meditation or mindfulness. That's just one example.
And then with regards to that too, do you have any recommendations on limiting, maybe technology where the adolescents are sitting in front of their phone? Because I know that's been linked to depression as well.
Well, that's so hard to limit that now, because when they can't interact in person, perhaps with their peers and their friends, and then it's really hard to limit how much time they're spending either through social networking with their phone, their computer, by connecting with their friends, or gaming. But I do think you need to limit that somewhat. And ways to limit it are to have set bedtime, that computers and phones are off at a certain time. But I think that's been a big challenge for families, because normal limitations around that are necessary. School limits those kinds of things, and many families and parents do. But at this time, it's almost like a double-edged sword, because already the kids can't connect with their peers, and so then if you limit it as much as you were before, I think you just need to be thoughtful and maybe work it out with them, and then maybe have some alternatives. So if they can't be gaming with their friends all the time, what other kinds of things would you propose? How can you spend some quality time with them so that replaces that, and you can help, that can help limit that. Another thing, just to add that I think that you can encourage your kids, but we all should be looking at, and it's been a helpful way for people to cope, some of the people that I work with, is self-improvement opportunities. I have a colleague who's studying for another business certification that's going to help him. It's expanding his horizon, you know, and so are there ways that we can work on growing, improving? I know a lot of people are redoing their bathroom or doing something in their house. They're funneling the stress and some of the things that are happening with this COVID into making their world better, making themselves better, or making their world, their home better. And I think that's a great way to cope, and it's something we all should be thinking about doing. So that's just another coping thought.
And then Carmen, you were talking about assessments, you know, when it came to the security. A question came in and said, when do you suggest using those assessments?
If a client comes forward to disclose that they're living in a violent situation would be one circumstance. If a restraining order has been filed and granted, I would certainly want to try to have a conversation with the survivor if they agree to that. Those would be two instances. I would not do it if you're doing an exploratory conversation with someone where they haven't disclosed. I would only use it after they've said, yes, I am living in a violent situation. Then you could offer to walk through it with them. That's the other thing to remember is we're not using an assessment on a person. We're wanting to do it in partnership with them to get some information, to get them some clarity, and then partner with them to come up with a safety plan that you can implement at work. And they also need a safety plan for their life. And usually survivors are reluctant to bring that much information into the workplace. Rapport, I cannot stress it enough, rapport is so critical. These are sensitive issues that people are not going to want to bring forward. But you can be a partner if you have good rapport, you've given them permission, let them know that the culture is a safe one, that you take the issue seriously. And then when they come forward is when I would look to dive more deeply into the situation with them. And I would have one person, either your security or your HR, but I'd probably have my security do it, not HR, because they may be afraid of losing their job. You'd probably have your security person be the one trained to walk through the staff person. I'd also say you should call an advocate to have a conversation with, to walk through how to approach the situation and get some suggestions. And they could also talk to the client as well.
Steve, do you have any other questions that came in?
No other questions that came in, but I think that Dr. Lehrman, you had a hard stop in a few minutes. So if that's still the case, I wanted to just take the time to say thank you for joining us. I know we're going to go through a few more questions with Carmen and wrap up in a little while here yet, but thanks again for all your time. And this was just wonderful information.
Thank you. It was a privilege, and I wish everybody the best with their work and business and with their own health. And I really appreciate people taking time out to be thinking about how they can better support their employees and their employees' mental health. So thanks for including me. Have a great day, everybody.
Yeah,
Stay
thank
safe.
you.
Dr. Lehrman.
Thanks, Carmen.
Thank you, sir.
And then Carmen, with regards, any other resources that you can maybe list off? I know you have quite a few at Sojourner. We've talked about NAMI. I know there's Rogers Behavioral that works with mental health in teenagers. And
so in terms of addressing violence in people's lives, there are a number of options. Calling law enforcement is usually an option when someone no longer feels safe or they're being threatened or attacked in the moment. So they'll call 911, and that triggers a whole series of responses pre-COVID that, and hopefully is still operating with some changes under COVID. Calling law enforcement, there has to be a mandatory arrest. If an officer determines a crime has been committed, they write a report, send it to the DA's office who reviews it, and then a case is charged or not charged and goes into the court system. The value in that is, you could get an immediate no contact order. The person who's hurting you is barred from having any contact with you while the case is moving forward, which can add a layer of protection. Also difficulty. Sometimes when law enforcement is called, violence increases. Some survivors opt to file a legal order of protection, which is a restraining order. As I said, we're doing those remote now. Some officers, when they respond to the scene, they'll recommend that you also file a restraining order. You can make a request of the court. You have to file a petition. It can take, it's time consuming. So as a company, you might want to think about allowing your staff person time to be able to apply for that, take time off if they have to appear in front of the court. So you file your temporary, it gets granted, you show up 2 weeks later for the final injunction. You have to go down to the courthouse to do that. And then the order is in place, I think 4 to 10 years. You can request 10 years is a severe case. The court would entertain a request. It's unlikely. I've known of one case that's been granted for 10 years. And then the legal order of protection bars any contact between the person who's hurting you and you. The other option is going into a shelter like Sojourner Truth House, or Community Advocates also has the Women's Refuge. Those are, on any given day, we have clients who are fleeing violence, who are homeless because of the violence and need housing and shelter. We have the capacity for up to 43. We're a domestic violence shelter. Community Advocates has a shelter that houses domestic violence survivors and homeless, I think, on the same property. I think they have 70-something beds in their facility. Every county in Milwaukee, in the state, has a domestic violence provider and shelter. So there's a network that you have availability to access. So if a client comes to us and we don't have an opening, we can get them to Racine, Ozaukee, Kenosha, Madison, Dane County, or throughout the state. So, the other option is safety planning and conversation with an advocate, calling our 933-2722 hotline number and talk to someone if you're in a violent situation or you need information. If you're an employer or a loved one or anyone who wants information, you can call our hotline, or survivors can call and we'll do safety planning. So those are some of the options. At Sojourner, we served 12,000 clients last year, and the majority of them were not in shelter. The majority were working, living out in the community, had a safety plan in place, and were navigating the challenges that come with trying to get out of violence. It can be a difficult process. So safety planning is really critical. We have lots of brochures and documents on our website that you can download as well, familypeacecenter.org.
Thank you, Carmen.
Mm-hmm.
Is there anything else that you want to add about some of the topics that we've covered?
I don't think so. I'm grateful that you covered this topic. I think we live in a society that doesn't want to understand the level of violence that actually is present for many people. And I think the more we talk about it, the more we make it something that we can all see differently and engage on differently. So I'm grateful that you prioritize this topic. Thank you for doing that.
Thank you, Carmen. We appreciate your time.
Mm-hmm.
Yeah, Carmen, a couple of follow-up questions to a few things you had mentioned. One was the work safety plan that you had discussed earlier. When there might be a restraining order against an abuser, could you give some examples of what type of a safety plan would that look like?
So we always ask the survivor if they're willing to show a photograph of the person that they filed the restraining order against, or the person who's harassing them, the type of car they're driving. We ask them to share that with security as one part of the safety plan so that security personnel can keep an eye out. Most abusers have said they do go to work, they use company time, they use company property, and they do harass. I think in our last study, 94% of our survivors said they were being called and the abuser was showing up at work or driving by. So harassment and abuse is happening on company time. So if the survivor is willing, a photograph or the vehicle, so that you have a heads up if you see that person. You might want to consider changing their work location within the company. If the abuser knows where they work and can get to them, change their phone, maybe change their duties. Those are all options. Look at a flexible work schedule. So those are some of the things you could embed in a safety plan while the person is at work. Having security escort the survivor to and from their car is also could be part of a safety plan that has happened for survivors. They're vulnerable in a variety of ways when they leave the environment. Like if they decide to leave the violence will usually spike. And if work is the only predictable place I can find you, most abusers are showing up there. So security can be a great asset to survivors. Did that answer your question, Steve?
Yeah, I believe it did. The question came in earlier. I think that was a good answer for that. And the hard part is that each situation is so different, and I think that helped cover such a variety that at least it's a good way to keep people or get people to start thinking about options.
You know, I kind of think of a safety plan as an evolving conversation or a thought that a person has to have about all the ways and places that they live their life, right? So what you're really trying to do is reduce the vulnerability of that person and the access that the abuser has to them. So thinking about safety is something we say to survivors they need to be thinking about in all their environments, where they live, where they work, where they socialize. How they get in between those places also can make them vulnerable. What abusers will do if they're on that lethal end of the continuum, they will be looking for opportunities to get access and to inflict harm on that person. And so the plan is really about thinking through what are the measures I can put in place to increase my safety. And that may change over time. It may mean different things at different phases. It may include restraining order, right? It might include calling law enforcement, getting a restraining order, going into a shelter, relocating or not. It's complex.
Very good information. I think, Suzanne, you had a question that came from SHRM. Do you want to maybe present that one now?
Yes, I'll do that. I actually have two questions, Carmen, and one is related to the situation where perhaps a supervisor goes a little bit further and really gets involved with the employee, and that employee then begins to call the supervisor at home, situation where they may ask to stay at the home. How do we balance all of that? So we want to be sure that people can approach us. We want to be open to that, but how do we also keep that boundary clean and clear so that there are no negative situations that result from the company or the individual as a result of that overstepping the boundaries?
I wrote a few answers about that. I think what's important is you need clear boundaries in general around your workplace. And I would consider boundaries that prohibit that behavior. I mean, policies that prohibit that behavior. I don't think it's helpful to have a collapse of boundaries between employees and the people they report to. I don't think that's healthy in any way. We might be compelled, right, because we're human beings, to want to help that way. But I think it's just a conflict of interest. And so I would proactively be thinking about policies that actually say you're prohibited from doing that for specific reasons, right? It's not healthy for the survivor, and it's not healthy for the person who supervises them to have that collapse of boundaries. So I would say it's prohibited. Here's some of the ways that you can help. You can help them, make time to help them call the hotline. You can even accompany them to speak to an advocate. You can invite an advocate into the workplace to speak to them. You can try to get them into a shelter. Maybe help them get into a hotel if they need to leave the violence and can't get into a shelter. I would say those are some of the things that I would do proactively within my HR department to just educate everybody in the workplace about why it's important to have good boundaries. This is a complex situation. It may take to get out of the circumstance, and I just don't think it's healthy to have that collapse of boundaries.
Thank you for that, Carmen. And then the last question that I have for you and it has to do with the disparity of COVID. And I guess what I'm seeing is that people are finding that there's a real difference in the way we look at COVID. And some people just feel it's okay not to wear masks and feel it's okay to not social distance. And so I'm concerned about this as we re-enter the workplace. We've been home, we've been a little bit safer. And how do we handle that? You know, I've had conversations with people that said, well, why can't we just reopen? And I said, well, you're not going back to work. You're not going back to work in this area of the city. You know, so there's these differences with the disparity in terms of different populations, the density of population in the city. And how do we work that out as teams going back to work together that have very different opinions on what this all means?
It's difficult to, I think we, first of all, as leaders in our companies, we have to lead on this issue, and we have to hold space for and understand that there's a variety of ways that people are navigating this, right? This pandemic. So I think it's important to acknowledge that, and as leaders to say, here's the way we're going to navigate this restart at our company, and here's the principles we're going to use. And we understand that there's a lot of fear and anxiety and uncertainty, but here's what we're going to do to ensure that we can restart in the best way possible. And we're going to ask that people respect each other. That's an important core value, I think. Respect that other people are having a different experience. They have different life circumstances that allow them or don't allow them to take in information in the same way. But I think companies need a clear plan for restarting, and they need leadership, and they need to bring people along. They need good communication. They need, like for us, you know, I've been saying to staff, like I said, they were most concerned about how quickly we're going to start. I said, we are not going to start quickly. Here's the things we're going to do and we're putting into place. So I think people need clarity, and we need to say to them, you have to respect the differences in emotion around this pandemic. And it's a hard issue. That's the best advice that I got. That's what I'm trying to do here at Sojourner. The other thing, I want to jump back to the other question real quick. I wanted to say the reason that you don't want to collapse of those boundaries is you don't have staff in your companies that are experts in this issue. And I think it's important to bring in people who understand domestic violence and what could be happening. It isn't to say that staff shouldn't support each other, but I think without that training, you could end up leading someone down a road that isn't maybe the best path for them. And so that's another reason why it's important to have you know, good boundaries between staff who work together. On the issue of restart and the disparity, I have noticed it here at Sojourner. You know, I have advocates who have continued to work in the shelter. They come into work, they don't wear masks. At this point, it's strongly suggested. We're not mandating masks. I have other staff who had to go out on FMLA because they, you know, needed to quarantine and needed to take that time because of circumstances that were happening. And so as leaders, we have to help everybody navigate the complexities of restarting. And it doesn't matter when we restart, whether or not people buy into what's mandated. They just have to respect. So for instance, we're going to start taking temperatures on June 1st when the building opens up fully. All staff have to comply with that, regardless of what they believe about temperature taking, right? We are putting a mask wearing policy into place that when you're in the open areas, you have to wear your mask. And so we're putting in guidelines, and then we're supporting people in following them. I hope that helps, Amy.
It does.
Okay.
Very nice. Well, Carmen, I really appreciate your time, and this has been super insightful. I know that we've all worked together a couple times, but I've always grabbing little notes and tidbits. So I definitely appreciate it again. I know that I've tried to do my best to keep up with the questions that were coming in. If anybody didn't get a question answered that I might have missed, please retype it in there. And what we can do is we have about 15 minutes left here. So I can try to get back to those. But in the meantime, what I would like to try to do is switch over to Sarah Mullaney, who's from NAMI Greater Milwaukee. She is part of the development and walk manager. And they just wanted to kind of introduce NAMI a little bit more and kind of dive into a little bit of what the walk is all about and how that money is being raised and handled there. So with that, Sarah, I'm going to right click and send you over as a presenter.
Thank you, Steve. It's been my honor. Thank you, Amy.
Thank you, Carmen. I appreciate everything.
Hi, Steve. I'm on now.
Okay, that was a quick transition. Thank you.
Do I need to turn on video or we're just running the PowerPoint? So I wasn't sure.
Whatever your preference is.
I'm okay with either. So if you want, I think Suzanne gave you just some introductory information. I think it's fitting as a transition. That first video on it's okay to not be okay. Do you have that link?
I do not have that PowerPoint, so I don't know if you're able to just share it from your screen. That might be the easiest.
Oh, okay. All right. Well, just give me 1 second. I don't know if you have any other questions that need to be answered. I'll try to get that set up real quickly. I misunderstood. Let me get that real quick. I apologize.
No worries. I'm not seeing any additional follow-up questions yet.
Should have the link, Steve, for Sarah. I sent it in a follow-up email.
I don't have access to that right now.
Okay.
Sorry. My apologies for not having that built in here. I just looked, I don't see any additional questions. If anybody has questions or follow-up concerns or looking for additional resources, what we can also do is just don't hesitate to reach out to myself, Suzanne, or anybody else that might have been on here. And what we can do is we'll get you in touch or at least point you in the right direction for the types of resources, whether it was the phone numbers, email addresses, or websites. So if you have anything like that, what I'll do is I'm going to send a message out to all attendees with my email. You can definitely leverage that, and I will get you in touch with the right folks, or at least get you in the right direction.
Thank you, Steve. I have the slides up on my computer, so in order to share, just if you can just steer me a little bit if I need to just do share screen.
Yeah, so yep, share screen, and then that should pop up on all of our sides.
Okay, all right, well, cross your fingers. I apologize for the technical difficulty here.
Easy to do it. That was my miscommunication on my side. I'm sorry.
That's quite all right. Are you able to see my screen now?
Yep, definitely.
Okay, perfect. Let me just go ahead and go into the slideshow view. Thank you all for being flexible. Thanks for the invitation. My name's Sarah. I've been an event manager for a long time. I've been with NAMI for about a year now. Our annual fundraising event is typically a face-to-face event, but because of COVID-19 and just our board's decision to exercise caution with bringing 1,400 people together for a community event, we've gone virtual. So our event is this Saturday. We're actually joining with about 33 other cities across the nation, NAMI affiliates across the country, and thousands of people will walk virtually and take part in our fundraising event. The money that's raised by our folks, by people who are walking with NAMI Greater Milwaukee, that money stays here in our county, that stays with NAMI Greater Milwaukee and for the services that we provide. So again, it's this Saturday. It's not too late if people wanted to register or take part or make a donation. I have a short introductory video here from Molly Fay. So if you're from the Milwaukee area, you may recognize her from the Morning Blend. I'll just let her do a little intro, and then I'll quickly wrap up about a little bit more about our walk.
Hi, I'm Molly Fay with the Morning Blend on TMJ4. Today is Mental Health Awareness Month, and you are not alone. Join me and others around the Milwaukee area and thousands around the country this
to Molly. She's been a big supporter. She had one of our walk managers and one of our team captains on her morning blend show, and she has been a consistent advocate for mental health and working with NAMI Greater Milwaukee as the MC at our event for several years face to face. As I mentioned, our walk is part of a national movement. NAMI is a national organization, but the money that we raise will stay right here in Milwaukee. The need, as you've been discussing and as we're recognizing, mental health is top of mind for everyone in our country right now. And we are all experiencing some of the stressors and pressures of disruption of routine and just the feelings of uncertainty that are coming. So mental health care and mental health awareness is so very key at this point. The day itself on Saturday will be deemed a National Day of Hope, and we are hoping for national coverage from media and just from the number of people that are participating. So it's very exciting, even though we did have to go virtual. In some ways, this has simply eliminated some of our geographic boundaries to include people from other areas and for people who may not have otherwise been able to join us. This is one of our team captains. Doris and Luther Cloth have raised over $70,000 for NAMI Greater Milwaukee. They walk in remembrance of their son, who they lost to suicide. We do this to raise funds for NAMI, as I mentioned, for our programs and services, the kind of crisis intervention training that Suzanne works to organize, our family-to-family classes. We do this to build awareness of mental health by sharing stories and putting a face to the name where there's often stigma. And then we do it again to honor and remember loved ones who may have been lost due to their mental illness. There's our lovely Suzanne. Our mission is to provide support, education, and hope to all of those impacted by mental illness, and we do this at no cost to the recipient. So we're able to offer family-to-family classes. We're able to offer support groups and peer-to-peer classes and in our own voice presentations at no cost because we get funding from the community and from our supporters. So in a nutshell, that's basically about our event. I'd encourage you to take a look. Our website is namiwalks.org/Greater Milwaukee. You can also visit our website or follow us on Facebook and see our virtual event programming on Saturday and see some of the pictures and videos that people will be sharing. But Steve, thank you so much for including me in this webinar today.
No, I appreciate it. Thank you for showing us all that. It's very exciting that we're still able to see it progress and move forward despite not being able to hold it in person. But with that, I do see there was a couple questions that had come in, and one of them was about, getting credits for this particular segment here. So if you do have questions or need us to help fill anything out for you, please don't hesitate to email that to me. I do have the SHRM form for those of you that are looking for the SHRM credits. So just email me to the email I sent to all in the chat, and I will definitely get those launched back to you in the next week or so here. There's one last question here, and I'm sorry, Tracy, I'm reading through this one on the fly. What advice do you have on what to do when employees do not utilize the resources they have been provided to them to manage the anxiety and depression? I don't know, Carmen, if you're still on, maybe that's something you could help kind of address with us in the closing 5 minutes here. If we provide them resources and tools and they're not taking advantage of that, what are things that we can do to help kind of guide them and urge them to use those resources?
Well, survivors have said they don't want to be treated special. They want the regular HR process to take place. So I think you should continue your normal HR response to any circumstance. I would say it's important to let them know if it's impacting performance that you want to help and be available. But if they won't take advantage of it, I think you have no choice but to go forward with the normal progressive HR process.
Yeah, and I know that's a really challenging one. That question does come up on a regular basis. I think the biggest thing is to just really kind of lean back on those policies and procedures and work through it together with your HR team and just kind of come up with the best options there. So I do appreciate that.
Yeah, I think it's important to let people know you care about them, you want to help, here's the resources, but at some point they have to be invested in taking some sort of action on their own behalf.
Right.
They won't, it's difficult.
Yeah, it's a very challenging situation there. Amy, I don't know are you muted?
Was.
Oh, that's okay.
My understanding is as well, if they are classified, you know, with one of the mental illness, so then you have to look at the Disabilities Act and make reasonable accommodations. So it
Right.
just depends on that, and you'll have to just check in with your legal department and HR, you know, make sure you're following those guidelines.
Right.
We're losing you, Steve.
Yeah.
You're cutting in and out for us. Do we have any other questions? Technology, right? Add to the stressors.
Right.
We'll give him a minute, but I have a feeling he's
Yeah, I think he's,
done.
yep.
Well, I know we're a few minutes early, but I don't have any other questions for you, Carmen.
Okay. Thank you again to all the participants for allowing me to have some of your time to talk about this important issue. I'm honored and I'm grateful. Thank you.
Thank you, Carmen.
All right. Bye.
And there is SHRM credit for this for those HR folks. So all we have to do is just you're going to be getting an email sent to you for the instructions for it. Goodbye, everyone. Thank you.